Tonight I wanted to go over, we'll talk a little bit about so-called anti-aging medicine, hormone optimization, kind of general overview, and then we'll get into more of the meat of the talk about bioidentical hormones. And yes, we'll talk about Suzanne Summers' book and good things, and maybe some things that aren't quite accurate, but let's go ahead and we'll get started. All right. So we'll talk about there's a paradigm shift that aging is a disease that can be prevented or reversed, that we are not prisoners of our own genetic destiny. Aging is often caused by damage to the cell molecules, the acids, the cell ultrastructure, the cell function, and aging is a tug-of-war that we can win, from Michael Fossa. So someone kind of went crazy with the special effects there, but we age because, here's the big difference now. We think we age because our hormones decline. Our hormones don't decline because we age. So it's totally the reverse. We can stay young and vigorous by supplementing hormones to more youthful levels. So here's what they call the health span curve. And here's basically, this is your vitality and your maximum functioning capacity. As you're young, you're functioning at optimal level, then you start declining. You start getting back pain, you start getting arthritis, diabetes, and then what happens is then you basically have these years of where you're not feeling good, not a good quality of life, and then you die here. Now, so what happens, what we basically do, what does standard medicine do? They prolong the agony. 80% of the money spent in standard medical care is in the last year of life. And so what happens is you still have the same problems here, you're feeling terrible, but hey, we kept you alive for another 5 years. I mean, what good is that? So what we want to do is basically called squaring off of the longevity curve. So basically you have a good life, and then you go. But hey, you don't have these years in the ICU and in the rest home. You had a stroke, and they're feeding you with a tube. So that's the goal, is to be strong and vigorous for your entire life. Okay, so we want to, again, increase the health span, not just the lifespan. Who wants to live longer, if they're getting in the nursing home and they can't do anything for themselves? So increase your lifespan if you're strong and vigorous, if you're happy and content and mentally and physically well. So again, no one wants to live longer with a debility or chronic illness or cognitive impairment, with Alzheimer's or other dementias. So traditional medicine, we can treat the outcomes of aging with anti-aging medicine. Again, I don't like the term. I hate the term, but we can really change the process of aging. So we intervene much sooner and prevent these things instead of waiting for them to happen and then treating them. So endocrinology of aging. Aging involves a decrease of mental capacity, decline in immune function, loss of muscle mass and bone density, increased fat mass, frail. Most people die because they're frail. They slip and fall, break a hip, and then they get pneumonia. And so we prevent that. Most aging individuals die from atherosclerosis, cancer, and dementia. Bioidentical hormone replacement can prevent the above diseases and the physiologic decline. So when we treat the aging, the decline in hormone levels, we can prevent and don't have to treat in the future the coronary artery disease, the cancer, the dementia, type 2 diabetes. We pick up so much pre-diabetes and can reverse it. And the problem is, for instance, doctors will check sugar levels and say, you're fine, you're fine. One day you go in and they go, oh, you got diabetes. We could have reversed it 20 years earlier. Degenerative arthritis, again, body composition, osteoporosis, immune system decline, loss of libido and sexual function. So let's look at this is a study just about how doctors, the big thing is cholesterol. Hey, let's Lipitor and Crestor. Let's just, the doctor, you basically go in, you get a CBC done, a chem panel on cholesterol, and they go, oh, all they do is focus on this cholesterol. But why is the body making more cholesterol? The thought with this study was they felt that the cholesterol was actually an attempt to try to make more hormones, because the hormones are made from cholesterol. So what they did, they had a 6-year study, 41 patients with high cholesterol, and they basically replaced all their hormones. And they found 100% of the patient had significant reduction in total cholesterol and the LDL, which is the bad cholesterol. So the authors summarized, when we become deficient in pregnenolone, DHEA, testosterone, progesterone, etc., our body responds by overproducing cholesterol in an attempt to restore healthy hormone balance. This article describes how a deficiency in these youth hormones is the underlying cause of many disorders associated with normal aging, including hypercholesteremia. So hormones drop, the body starts trying to make more hormones and increase cholesterol. Cholesterol is the backbone of the hormones that your body makes. So you need to have cholesterol to make hormones. What they also found was interesting is if you just did one or two hormones, it didn't work very well. You had to replace all the hormones. And this hormone was also in 2003. And here's the graph here. You see the patients here. Here's their total cholesterol before the treatment with all the bioidentical hormones. You know, cholesterol here, 325, drops to 200, and just huge differences in every single person. And that's what we find. So instead of just looking at the cholesterol, let's treat the cholesterol, let's treat the underlying cause. So New England Journal of Medicine, the overall deterioration of the body that comes with growing old is not inevitable. We now realize that some aspects of it can be prevented or reversed. Daniel Rudman, New England Journal of Medicine, 1990. A number of aspects of the aging process of the endocrine system invite the development of routine medical intervention programs offering long-term replacement therapy with one or more hormones in order to delay the aging process and allow us to live for a longer period in a relatively intact state. So again, you don't have that decline. Endocrinology Age Science, 1997. So what do we do at the Hormone Longevity Medical Center? We do very extensive laboratory testing, and often our standard routine panels are 30 to 40 tests. So we look for the underlying cause. For instance, we look for thyroid. About let's say almost 100% of patients come in and say, "Oh, my thyroid's been checked; it's fine." And we look closer, it's significantly low majority of the time. So again, we'll optimize hormones through the use of bioidentical hormones, not synthetic. And again, we'll talk. The majority of the talk will be on that. Through the use of nutritional supplements, again, bioidentical hormones, we improve the physiological functioning, so you make you feel better, and then decrease the risk of heart disease and cancer. So really, I hate the term again, anti-aging medicine. I really like more we practice advanced medicine, where we go above and beyond the standard of care established by traditional medicine by incorporating proven techniques, disciplines, technologies, and philosophies drawn from around the world. We are in the front line raising the bar for patient care and staying on the cutting edge with continual review of the medical literature. And that's what we're here for. We do is review the research and bring those studies to the front doorsteps of patients. And this is actually, this professor here at UCI has been studying what doctors know. Because so many people come in and they go, "How come my doctor doesn't know that?" And they'll go back to the doctor and say, "Oh, there's no studies on that," and we'll give them 10, 20 studies. So he found, his quote, "Most doctors are practicing 10 to 20 years behind the available medical literature and continue to practice what they learn in medical school." And that's a big problem. There's so many studies coming out. How does a doctor sort through all this? They don't have the time. There was a breakdown in the transfer of information from the research to the overwhelming majority of practicing physicians. Doctors do not seek to implement new treatments that are supported in the literature or change treatments that are not. And the current reimbursement system in the United States is a significant factor for this lack of this forward thinking. And that's the thing. The doctor, basically insurance says, okay, if you have this, you can do this. So why should you go learn and do all these new different things? Because the insurance company is just going to dictate what tests you can do and what treatments. New England Journal of Medicine, 2003.